everything might not be fun.
Yeah, the politicians keep saying, why is our healthcare system so expensive? And like, duh.
How does that make any sense?
We'll figure it out. This is the thing, I'm just getting totally unhinged now, and I don't know what to do. Hey Mike.
Hey Andy, how are you?
How you doing?
Good.
So we're in downtown Columbia, the city we live in. I live in. You're close.
Yeah, that's it. Right.
I want to talk a little about the idea that we have constant sickness in our society when it actually doesn't exist. The number one cause of sickness in our society is what?
Doctors.
Doctors. Us. And why do we want you to be sick?
Because you need something to take care of. It's your job. It's your job to fix things.
Well, yeah. If
you can't fix it if it's not broken, so it's
you're
got to be
sick, we got something to do.
That's right.
It's
your nature. Well,
it's our good nature.
Or
it's our good nature.
Or it's human nature.
It's human nature.
Everybody wants to fix things that they.
So who else wants you sick?
Who else?
Drug companies?
Okay, yes, they do.
Sure. Hospitals?
Yeah, I was just finishing the
Specialists?
thought that to a hammer everything is a nail.
Yeah. We want you sick. So the American College of Cardiology,
Your favorite?
My favorite group.
Yes.
It's like my number one group. I want them to call me and invite me to be president. But they came up with a statement 2 weeks ago that, in fact, 50% of all Americans have some kind of cardiac disease, some kind of heart disease. 50%. And those people should be seeking out help, should be going on medicine, should be finding doctors. So how do they come up with that kind of statement? Well, one day, I went to sleep one night a couple years ago, and when I woke up in the morning, I found out that 30 million more people had a diagnosis of high blood pressure than had it before I went to sleep. And that was because of the American College of Cardiology. Their goodness.
Yeah.
What they did was change the definition of what high blood pressure is. So it used to be, if your blood pressure was 140, you had high blood pressure. They said, now let's make it 120. Wow, look how many people are sick. We got to treat them. We got more drugs, more visits, more stress tests.
And cholesterol's been doing the same thing, right?
Cholesterol's been doing the same thing. The number keeps coming down.
Was it as high as, what was the highest?
I remember the...
I think I remember 300, which is
or
crazy.
250.
250.
Yeah.
And now
now the LDL cholesterol is to be below 100. In fact, my dad, who is a smart man now. I used to make fun of my dad, but not anymore. He's become the smartest patient in the world. His doctor, he's about 80. He has no heart disease. He just had a catheterization done by another dumb doctor who wanted to make sure he was okay. He is okay. And his doctor said, why aren't you on cholesterol medicines? Your LDL cholesterol is above 100. And my dad smartly said, well, how much does cholesterol actually correlate with disease? And the doctor said, go on the cholesterol medicine. Doctors don't know. But the truth is, cholesterol doesn't correlate with disease. So as we keep pushing down the number, we're putting more people on cholesterol medicines. We're creating a disease. The disease is high cholesterol.
Well,
That's not a disease.
What's going on with the body of doctors that is making the recommendation? Is the American Medical Association?
No, they do.
Who sets the thresholds?
So a lot of these societies, the American College of Cardiology is a cardiology society.
Okay.
So they decide that stuff. And Congress has given them the right to make those decisions. And Medicare, the main insurance, takes their recommendations and makes them into what we call quality indicators. So i.e., if I don't get my 80-year-old's blood pressure below 120, then I am considered a bad quality doctor, and my pay will be cut.
And how big is that body, and how do they get paid, and how do they get selected?
All good questions. They are voted by other members of their society. The blood pressure guidelines, they picked what studies they wanted to pick. There are lots of studies that say just the opposite.
Yeah.
In fact, two other societies, Family Practice Society and the Internal Medicine Society, made completely different guidelines. They made the blood pressure 150.
Yeah.
150. We also have a diabetes epidemic. Do you know why? People are overweight?
Yeah.
People aren't exercising? No. That's not why we have a diabetes. Guess why we have a diabetes epidemic?
I gotta say that we do a lot of processed sugar compared to other countries. That's got to be part of it.
But we did always. Why do you think we have a diabetes? Come on, Mike.
Okay,
Come on.
doctors.
No, it's because we changed the definition of what diabetes is.
Yeah,
People
okay,
don't
so
realize
still part
that.
of it.
It used to be.
The doctors are still.
So it used to be the sugar was, you were diabetic if your sugar was above 140.
Yeah.
Now you're diabetic if your sugar is above 99. So you change that number, you've now created a diabetes epidemic.
Yeah.
Now you say, holy cow, why are all these people diabetic that weren't diabetic before? What happened? No one looks at the fact we changed the definition. And so what I'm thinking of doing, and you tell me if this is a good idea, is I'm a geriatric doctor. I take care of old people.
Yeah.
I want to change the definition of who's old. So I'm thinking that anyone over 25.
Yeah.
And all of a sudden we got all these old people now, and they better go see an old person doctor. So it's going to help me a lot if you're with me in this. We could create a society called the Society of Geriatric Beneficence.
Yeah.
And our job is to look at all the studies and see what it is to be old. And we'll change the definition.
How about some of the other questions though? You said, so how big is this body of the cardiologists?
It's a big body. They have a big...
It's 100? It's 1,000?
Oh no, the
Anybody
actual...
that wants to pay their $100 a year dues is a member?
And their conventions, and almost all cardiologists are members.
Okay.
And some people are on the board, some people aren't. And they have big conventions. I remember once going somewhere
and
in
of course
Baltimore, there were 20,000 people. There were 20,000 people at this conference.
Of course, they want to see their own profession get a lot of work.
They
They're
do.
push it. So
And they're
and
gonna
it
do what
doesn't
they
take
can.
many.
It's self-serving.
Right, and it's
Yeah.
just like the neighborhood around here is kind of overzealous, and it's the 10% or 5% of people that are overzealous that take control. So, yeah,
Is that your alarm?
yeah.
See,
It's time for us to run.
That's our alarm. That means we can't sit here and talk all day. But I just want to tell you, when your doctor tells you you're really sick, you got this disease, that disease, this disease, you probably don't. Fixing those things is probably not going to help you that much, like cholesterol. Diabetes, you got a little flexibility. Blood pressure, a little flexibility. Don't let the doctors think you're that bad off. Okay, let's run.
Let's run.
Hey, so if you're equally annoyed by our dysfunctional healthcare system and all the garbage you're being fed, then give me an email, log on to my website, which is listed down here. Let me know what you want me to talk about, and I'll just keep feeding you information, and we'll discuss this and hopefully make some changes. See you later.